Welcome to Learning English, where we're ready to elevate your language skills. We learn through stories that are slow, clear, and enjoyable. Relax and savor the journey. 1. Introduction. Picture this. You have a minor problem and visit the hospital. Perhaps you have a cut that requires a few stitches. Or maybe you've sprained your ankle. It's not a life-threatening issue. Sometime later, a bill arrives in the mail. The amount on the bill is shockingly large. It could easily be thousands of dollars. On the invoice, you see many different charges itemized. There might be a facility fee just for being at the hospital. Even briefly, there could be a charge for a simple medication like a single pill that costs an exorbitant amount. There's also a fee for the doctor's consultation, even if it lasted only a few minutes. This scenario isn't unusual in the United States. It's a common experience for many people here. This raises a significant question. The United States dedicates a vast amount of money to healthcare, spending far more per person than other wealthy nations. Yet Americans are not consistently healthier. For instance, life expectancy in the U.S. is lower than in many other developed countries. It's a puzzling situation. We spend a great deal but don't always achieve better health outcomes sometimes. Individuals receive medical bills for millions of dollars, typically for critical situations like major surgery. People who receive these bills often have no idea how they will manage to pay. It is incredibly difficult to cover such immense sums of money. Many in the U.S. turn to crowdfunding websites like GoFundMe. They share their personal stories, asking others for financial help to cover their medical expenses. This highlights how challenging it is for people to afford health care in the U.S. This story features a boy named Luca, who was born with severe health conditions. He required very expensive medical attention from infancy. His family had to resort to fundraising to help cover his medical costs. They needed assistance from other people to raise the money for his healthcare needs. Healthcare in the United States has evolved over time. It has transformed into a massive business. In the past, the focus was more on helping people without a primary concern for profit. Now, numerous entities aim to make money from healthcare. Hospitals seek revenue. Insurance companies seek revenue. Pharmaceutical companies want a profit. Companies that manufacture medical equipment also want to make money. Many people are employed in this large industry and require salaries. The patient is often caught in the middle of all these competing interests. They require care, but are the ones left with enormous bills. Due to the high costs, some Americans travel to other countries for medical procedures. It can be more affordable to have surgery or receive care abroad. Healthcare is now frequently viewed as a means to generate profit, similar to any other industry. It is not always seen primarily as a service to help the sick. This story will delve into why medical bills in the United States are so high. It will examine where the money goes within the healthcare system and demonstrate how this system impacts individuals. 2. How things change. Let's examine the past. 2. Understand how healthcare expenses grew to be so high. An informational graphic like a chart reveals the amount of money the United States has spent on healthcare. Around 1980, this spending began to rise dramatically. Before that period, U.S. healthcare spending was more comparable to other nations. The goal was to improve public health, but despite this noble intention, costs escalated instead of declining. Today, while the rate of spending growth has slowed, it remains significantly higher than in many other affluent countries. Before the government established programs to assist with healthcare payments, companies named Blue Cross and Blue Shield provided health insurance. At that time, they were not for profit. They operated as nonprofits, aiming to assist anyone who needed insurance. This coverage was mainly for major health events, such as when someone was severely ill or had a serious accident. Following a major conflict, the Second World War, the situation began to shift. Companies started offering health insurance to their employees as a job benefit. Many more people acquired health insurance through this method in 1940. Only about 10% of Americans possessed health insurance. By 1955, that figure had climbed to over 60%. This large pool of insured individuals presented a business opportunity. Consequently, other companies began selling health insurance with the intention of making a profit. Obtaining health insurance through employment altered how people paid. For medical care, patients no longer paid doctors or hospitals directly. The insurance company covered part or all of the cost. It began to feel as though no single individual was truly bearing the expense. By 1951, companies like Aetna and Cigna were emerging as major forces in this new for-profit health insurance market. This marked a significant step toward healthcare evolving into a major business. 3 more changes happened in the 1960s. The government launched 2 significant healthcare programs. One was named Medicare. This program assisted older adults in paying for their medical expenses. The other was called Medicaid. This program helped individuals with low incomes access healthcare. As a result, more people could receive help when they were ill or needed medical attention. However, for-profit health insurance companies continued to expand. They convinced more and more people to purchase their insurance plans. They recognized an opportunity to profit from the healthcare sector. Simultaneously, a new kind of hospital emerged. These hospitals were distinct because their goal was to generate a profit. Previously, most hospitals did not operate this way. They were typically non-profit institutions focused solely on helping people. But for-profit hospitals began to appear. Initially, there were none. But soon, there were many throughout the country. These new hospitals were often part of large, multi-hospital corporations. Later, even established organizations like Blue Cross and Blue Shield faced financial difficulties. They had been non-profits for many years and had helped countless people, but they started to lose money. To remain viable and competitive, they started to operate more like for-profit entities. They needed to generate revenue to continue their operations. Hospitals observed this changing landscape. They realized they could demand substantial sums for the services they provided. It seemed as if the patient wasn't directly paying the full costs. The insurance company was covering most of it. Therefore, hospitals began increasing their charges. Doctors employed by these hospitals noticed the significant profits the hospitals were making. They saw business professionals being brought in to help the hospitals increase their earnings. Doctors reasoned, "We work tirelessly to help patients. The hospital is making a great deal of money. We should also receive more compensation for our efforts." Thus, doctors also began demanding higher salaries for their services. Hospitals started to function more like traditional businesses that sell goods, but they were selling a unique product: health and medical care. This healthcare industry became immense. It expanded to become the largest employment sector in the nation, providing jobs for millions of people. All these employees needed to be compensated for their work. A significant amount of capital from private companies and investors flowed into the healthcare system. People began to view healthcare as a sector for financial gain, not just a place to help sick people recover. For why bills are so complicated, you might assume that costs would decrease if hospitals operated more efficiently. However, costs did not decline. A primary reason for this is the method hospitals use to create bills. Doctors, nurses, and resources, like medicine and equipment, all have costs. But medical bills in the United States are exceptionally long. They are not as straightforward as bills in some other countries. One individual mentioned spending a significant amount of time just managing medical bills. There are many professionals who work exclusively on billing. They do not provide direct patient care. To them, a bill is simply a bill, regardless of whether it's for a major cardiac issue or a minor problem. Bills are lengthy due to a practice known as unbundling. Consider purchasing an airline ticket. You pay for the ticket itself, but then you pay additional fees for your luggage. You pay more for a preferred seat. Healthcare bills can operate similarly. Hospitals use special numerical codes for every service they perform. There are codes for a vast array of procedures and items. Different codes correspond to different prices. A small laceration on your hand might have one price. A cut on your foot could have a different price. This is determined by its location and the method the doctor uses to treat it. In the past, these codes were used to help doctors track diseases and health conditions. However, in the United States, codes are now primarily used for generating bills. Doctors spend many hours at computers managing billing tasks, which means They spend less time communicating with their patients. Most doctors entered the medical field with a desire to help people. This time consumed by administrative tasks detracts from that mission. Perhaps all this data collection will be beneficial in the future, but for now, it contributes to very large bills and doesn't always result in better health for people. 5. Money for hospitals and doctors sometimes. Doctors are concerned about potential problems. They worry about the possibility of being sued in court. Due to this concern, doctors may order additional tests. They request numerous tests for their patients. This can make the hospital bill significantly longer and more expensive. It costs more money, but undergoing more tests does not always lead to people becoming healthier. Their health outcomes are not always improved by the extra testing. An association that represents hospitals has also raised concerns about financial issues. They claim that hospitals do not always receive the full amount they bill for. The bill sent out might be very high, but the insurance company or the government pays a smaller amount than the total listed. The hospitals also assert that the government underpays for certain patients. The government provides financial assistance for the healthcare of elderly and low-income individuals. Hospitals state that they sometimes incur financial losses when treating these patients because the government reimbursement is insufficient. This group argues that the hospital payment system is flawed. They describe it as complicated and broken. Hospitals claim they lose money on many patients because the reimbursement method is neither fair nor adequate. So doctors ordering more tests and hospitals claiming they're underpaid are contributing factors to why healthcare costs are so high. It illustrates the complexity of the system for both patients and healthcare providers. 6. About medicine and supplies. Significant portion of healthcare spending goes toward medicine and supplies. These are the items that doctors and hospitals use to help people recover. Sometimes health insurance doesn't cover all of these expenses, which can result in even larger bills for individuals. Let's consider Luca again. He requires specific supplies, such as bags for his medical needs. Mother displayed these items. They are very expensive. For just a few days' worth of these supplies, the cost exceeded $1,000. This is just one illustration of how costly supplies can be. The price of medication is also a major factor in healthcare costs. The prices of some medicines have increased dramatically and rapidly. For instance, there was a medication that once cost only $18 per pill. Then, the price for that exact same pill surged to $750. This massive price hike occurred overnight. This represents a colossal increase. Pharmaceutical companies often argue that they require substantial funds for the research and development of new drugs. However, many high-cost medications are protected by special government-granted rights. These rights, known as patents, mean that only one company is permitted to produce and sell that specific drug. It's as if they are the sole retailer for that product. If a person is critically ill and needs a particular medicine to survive or improve, and only one company sells it, that company holds immense power. They can demand an extremely high price for that medication. This is because people desperately need it and have no alternative sources. There is effectively nothing to prevent them from charging such high prices. Once companies saw they could do this, prices for various medicines began to climb higher and higher. This happened because a single company had complete control over the sale of that vital medicine. The high cost of medicine and supplies contributes significantly to the overall cost of healthcare in the country. 7. Having health insurance, it is difficult to focus on money when you are seriously ill. Imagine your house is ablaze. You need firefighters to arrive quickly. You wouldn't pause to inquire about the cost. Healthcare can feel very similar. A major issue that can be difficult to comprehend. Health insurance can also be challenging to understand. There are numerous different plans, such as HMOs and PPOs. There is a lot of terminology you might not be familiar with, like deductibles and co-pays. It is hard to make sense of it all. You might assume your insurance will cover all expenses, but this is often not the case. People frequently find themselves caught in the middle of this perplexing system. You may have insurance, but still be required to pay a substantial amount of money yourself. This is known as paying out of pocket. Your doctor might not accept your specific insurance plan. Furthermore, within a hospital, doctors and nurses may be employed by different companies. Consequently, you could receive multiple bills from various groups after a single emergency room visit. Your insurance might only cover some of those bills. This can occur even if you were treated in just one room. Luca's mother eventually stopped using ambulances for him, even when he was critically ill. They would drive him to the hospital at high speed instead. As a nurse, she could provide care. For him in the car, she would sit in the back and administer oxygen. Her husband would drive at 120 miles per hour on the highway. It was quicker and saved them money, as they couldn't afford additional costs. Like an ambulance bill, she was prepared to perform chest compressions in the car if necessary. Many people in the United States lack health insurance. Today, nearly 30 million people are uninsured. This number is lower than it was previously. About 55 million people were uninsured in 2010. Still, a higher percentage of people here are uninsured compared to many other countries, such as France, Japan, or Israel. Insurance companies are meant to negotiate lower prices from hospitals and doctors and cover a large portion of the care. However, the high underlying costs still create financial problems for those who have insurance. They frequently have to pay significant amounts themselves. Even with insurance, the high costs embedded in the system mean individuals still bear a heavy financial burden. The costs are passed from hospitals and doctors through insurance companies, and ultimately to the people. 8. The bigger picture and future high healthcare costs lead to numerous societal problems. People with limited financial resources can be pushed into poverty if they become ill. Receiving a large medical bill can make their lives exceedingly difficult. There is a vast amount of money circulating within the healthcare system. Many different entities, doctors, hospitals, insurance companies, and pharmaceutical manufacturers want a share of this money. Currently, efforts are being made to find ways to reduce costs. However, it is a challenging task because all parties are reluctant to relinquish the revenue they currently receive. It's as if they don't want to give up their portion. High costs naturally impact your personal finances, but they also affect the nation's finances. The government allocates a significant amount of its budget to healthcare. The government now spends over $1 trillion on healthcare annually. Experts predict that the amount the government pays will likely increase further over the next decade. This is partly due to an aging population. However, a major contributing factor is the rising expense of healthcare itself. Finding a simple solution to fix this problem is impossible. There's no magic bullet. But people are beginning to consider what measures could help initiate change for the future. One proposal is to increase information about how much things cost, a concept known as price transparency. Doctors, patients, and their families should have a clear understanding of the price for various tests, treatments, and services. Knowing the cost can empower people to make more informed decisions. Another idea concerns the price of medicine. Some medications are essential, but also prohibitively expensive. This is often because a single company holds the exclusive right to produce a particular drug. One suggestion is for the government to begin manufacturing some of these critical medicines itself. If the government produced them, it could offer them at a much lower price. This could help make life-saving drugs more affordable for everyone. The future for some individuals remains highly uncertain due to the rules of the current healthcare system. Consider Luca. There's a possibility he may require a second lung transplant before he turns 10. He has already undergone one transplant. However, current regulations state that doctors will not place him on the list for a third transplant. His mother is terrified by this rule. She does not know if her son will live long enough to see his teenage years or become a young adult. This is an incredibly difficult situation for her, as his future is so unclear. This uncertainty is directly tied to the rules and limitations within the healthcare system.